Hello, I'm Todd Didier, Senior Manager of Communications at the Primary Care Collaborative. Every month, the PCC honors thoughtful, innovative leaders who are helping promote the promise of primary care. This month, I'm thrilled to welcome Dr. Raymond Tsai, Vice President of Advanced Primary Care at the Purchaser Business Group on Health, where he leads a strategic initiative to implement advanced primary care in markets across the country, ensuring PBGH members and their employees have access to high quality, cost effective primary care. Raymond, thank you so much for joining us, and thank you for being a primary care champion.
Well, first off, thank you for honoring me as a primary care champion. Primary care is something that I am very passionate about and very, very excited to continue championing it for our country.
Fantastic. So, jumping right in, could you tell us a little bit about why you're so passionate about primary care, how you got involved in efforts to expand access to advanced primary care, and why this is something that you have made a focus of your career?
Is because when we look at the health of our country, it's getting worse, and we know that something's wrong with it. And we also know that underlying all of this is chronic disease. We continually grow our obesity rate, diabetes, and many other chronic diseases that are largely preventable with lifestyle. And so when I thought about choosing a medical career, I was thinking about what type of medical career do I want to have? And I chose primary care because I wanted to have where I could have impact on a community level to prevent chronic disease. And I felt the best place to do that was in primary care. However, the reason I am so passionate now about expanding access to advanced primary care is because I know it works. I've seen it work. I've spent the last close to a decade working on behalf of employers, implementing advanced primary care, and have seen all the great benefits from it, and am so excited to share those benefits with other patients across the country.
So, why do you think primary care is so critical, and why has the Purchaser Business Group on Health and its members committed to expanding employee access to high quality, cost effective care?
To be really short about it, it's common sense. But let me provide a little bit of context. So Purchaser Business Group on Health is a nonprofit collaborative of about 40 jumbo employers and public purchasers of healthcare that collectively spend about 350 billion to cover about 23 million Americans and their families. And as big jumbo purchasers, there's a lot of responsibility to that. And so they want to be sure that that money that they're spending is actually doing what they're spending the money for, which is healthcare, meaning health and care. And when we look at our system right now, unfortunately, the healthcare system does not always provide better health outcomes. And to do that, having a good foundation in primary care is absolutely critical. And we actually see this, right? When we look and compare the US healthcare system to other systems around the world, we see what lower investment in primary care is actually costing us in terms of health outcomes. When we look at life expectancy of the US, we actually see it dropping when it should be getting better. And yes, some of that is due to COVID, but we haven't really recovered all of that or recovered as fast as other countries. And a lot of that has to do with because we are dealing with a sick care system. We're very, very, very reactionary to people getting sick instead of trying to prevent disease. And so the reason that Purchaser Business Group on Health is really invested in this, and by invested, I'm telling you that these 40 jumbo employers and the board has made advanced primary care their #1 strategic priority. Just pretty much try and save the primary care system because it is common sense that to get better health outcomes, you need a high functioning primary care system. And we've seen it happen over and over and over again, meaning there are case examples within our members where their investment into primary care has shown better health outcomes.
Before leading this current initiative at PBGH, you helped establish primary care clinics for a large employer. Could you tell me a little bit about the motivation behind establishing those clinics and what impact it had?
Absolutely. And so previously, I worked for a company, a for-profit company called The Wonderful Company. Many people will recognize the company, even though the name is fun. It's actually the company that does the wonderful pistachios and almonds, the Palm Wonderful juice, Halo oranges, Fiji water. And a lot of their products are grown actually in Central California, which is a agricultural area with a lot of agricultural workers, with pockets of rural California as well. And you can imagine that there are a lot of health disparities because of that particular region dynamic. And it's health disparities that a lot of rural American faces. And so they did an employee screening and found that 50% of their employees, close to 50%, had prediabetes, and that's just prediabetes. That's not diabetes, which was another 12, 13% on top of that, which is absolutely unacceptable for the amount of money that we are spending on healthcare. And so they decided to do what common sense would dictate in terms of trying to prevent chronic disease, which is invest in primary care. And in doing so, we established advanced primary care clinics that really look at whole person health. So it's not just about the medical care from a physician, it's about being culturally competent and having patient navigators, or what we call health coaches, really help and guide a patient through a very complex system with a lot that needs a lot of behavioral change and a lot of social aspects to it as well. It's about integrated mental health. It's about physical health and physical wellness like PT. It's about nutrition. It's about being sure that all the patient's needs in terms of social determinants are also being addressed at the site as much as we can, along with medications and labs, and really just being very, very patient-centered so that we can help and be that quarterback and advocate to guide patients through the healthcare system. So if they do need care beyond primary care, it's not just writing a referral and letting them go. It's really about being very mindful of who you are referring to make sure that they're getting referred to high quality specialists, and then having somebody there to help them schedule that appointment, making sure the notes come back, and all those various steps that can make a patient get lost in a very, very hard system. And so that experience in and of itself, we saw so many benefits from. And some of this is published where we reduced that pre-diabetes rate or prevalence by almost half. And that is what healthcare should be all about. It should be about preventing disease, not just about waiting for someone to have diabetes and then trying to get good outcomes. Now, mind you, for those patients that already had diabetes, we also had good outcomes and we also track that. And it's not to say that is any less important, but the next step is really how do you prevent disease? And what does that mean in terms of health outcomes for communities, in terms of patient satisfaction, in terms of provider satisfaction as well, knowing you can make a difference. In terms of health equity, like I said, we're in rural parts of California at times, and we know that disparities exist there. And as well as in terms of healthcare costs, and prevention does impact healthcare costs in the long term.
So you've spoken about what a positive impact primary care can have and how it can be transformational when it's done right and supported right. What do you think the effect will be if we neglect or underinvest in primary care?
We already know the AAMC has published that there's going to be a shortage of about 30,000-ish primary care clinicians in about 10 years. And so that is going to make primary care just not accessible. And so if we're willing to have a system that just doesn't have primary care, then that's what's going to happen if we just keep letting it go the way it is, because there are less and less and less clinicians going into primary care because of how this is set up. And a lot of it is just due to the philosophical and also the perspective of where primary care sits in terms of its value in our healthcare system.
So the PBGH has done a fantastic job leading on this initiative, but you've also taken on a big goal. How can other organizations support your efforts to expand access to primary care?
At a very fundamental philosophical level, other organizations just have to realize that primary care has value and being willing to invest that value to get what we want from the healthcare system. Again, health and care shouldn't be that complicated. And so there's so many different stakeholders in the healthcare system. So whether you're, whatever you think about our healthcare system, I think it's a universal truth that it's just very complicated and there's a lot of players involved. And each one will have different levers in terms of how they can emphasize or support the importance of primary care and make it foundational to the overall healthcare system. And so it would be hard to kind of go through a list of all of them because, again, very complex. However, other organizations, just if they kind of ground themselves in just knowing, you know what, primary care is fundamental and it's exceedingly important, and we're going to do what we can within our purview to really support it, that would go a very long way.
So, continuing this focus on solutions, over the past few months, policymakers in DC have been increasingly attentive to the hurdles that people face when trying to access high quality, comprehensive primary care. What steps can policymakers take to help expand access?
Policymakers in Washington, D.C. in particular, have actually a lot of levers at their fingertips. But one of the biggest ones is that they control Medicare and Medicare payment and have a lot of influence over that. And the reason that's important is because Medicare, as a very jumbo purchaser, influences the market maybe more than they realize. And so I will give you an example from the employer side. There are many, many, many employers that use Medicare reference pricing to pay for medical services. Those prices are being used because many purchasers are not healthcare experts, and they're expecting the government to set the stage and be exceedingly thoughtful in terms of what is right and what will support the healthcare system and what will support the patients. And so they will follow. And so that responsibility is actually quite big. And I really, really hope that policymakers in Washington, D.C. think about that when they are setting policy, because what they are doing really, really lays the groundwork for everybody else. And I hope that also what they are doing is thinking through how the other stakeholders, like private purchasers, can engage in the work with them so that we can all work together to save primary care instead of trying to retrofit something that might not be applicable across different types of payers like the commercial market.
Great. Well, thank you. You've been very generous with your time. I'm going to leave you with one more question. This one's a little bit more fun and a little bit more optimistic. If you could snap your fingers and change one thing in the American health system overnight, it just would magically change, what would it be?
Just one thing. Wow. If I were to really pick one thing, it would just be fundamental. I really wish the healthcare system can deliver good health. That is really what it should be doing, and we're not seeing that happen. And that's partially a primary care problem, but there are actually a lot of other factors involved in that. And so I go back to basics. Healthcare, let's improve health. And that's what I would want if I can snap my fingers.
Well, I think it's hard to argue with that. Thank you again for joining us today, Raymond. Thank you for all your work helping advance the promise of primary care. It's phenomenal to work with you, and we really appreciate all the effort that you are putting in to make sure that all Americans have access to the high quality, comprehensive primary care that they deserve.
No, thank you again for all of your work and all the work that the Primary Care Collaborative does as well. And thank you for the honor of being a primary care champion.